Hello, good afternoon, ladies and gentlemen. Thank you for joining our session, our Facebook Live seminar session. This is Dr. Eric So from Island Hospital in Penang, and welcome to our audience from Penang, from Malaysia, and from the rest of the world. Now, this is one of the many series of talks that we're giving for our patients as well as anybody who's interested, basically on health seminars and various good practices in health, and that we would like to impart to the general population. So the topic I'm talking about this afternoon is women's health and the importance of HPV vaccination. So I'm going to talk to you about the story of a virus. And this virus is called the human papillomavirus. Now, viruses are very popular these days. Everybody is affected by it. Obviously, we're talking about the coronavirus. Now, the coronavirus is an RNA virus, but that's not what we're talking about this afternoon. The virus we're talking about is called the human papillomavirus, which is essentially a DNA virus. Now, what's the importance of a DNA virus? The importance is that DNA of the virus incorporates into the human DNA and hence can cause abnormal growth either in terms of causing cancer or obviously causing other abnormalities, in other words, growth in our body. Now, this HPV is all over, it's ubiquitous, it's all over, but there are more than 150 types of it. And of all the 150 types, there are 12 which are abnormally high in terms of causing cancer. All right. So therefore, the question now is it a common virus? Well, the answer is that something like 75 to 80% of people who have had sexual activity, both men and women, would have been infected by this virus sometime in their life. Now, therefore, you would think that, it's something worrisome. Well, the point is that it is actually easy to transmit this virus. Commonly, obviously, is by sexual intercourse. Sexual intercourse involves the genital contact. Sometimes there will be a manual genital contact and then skin to skin contact. And if you were to push the limit a little bit and let your imagination run a little bit, you'll find that actually the virus has also been found in formats, that means the tables and chairs and your bed sheet and things, undergarments, and of course some gloves or some medical equipment. But generally, the mode of transmission is often sexual and actually goes for the mucocutaneous junction, which means the junction between the skin and the mucous membrane, either of our lips, of our eye, of our nose, anus, vagina. Those are the common areas of mucocutaneous junction. Now, if you get the virus, what happens? Well, the good thing is that 80% of the time your body kills the virus, gets rid of it. You have no problems, you don't know you have it, life goes on, nothing happens. There is only the 20% of people who do not clear the virus, who cannot clear the virus, that the virus then goes into the cell of the person and then causes abnormal growth. Okay, so what abnormal growth are we talking about? This picture generally illustrates. Commonly for women, it is cancer of the cervix and a pre-cancer condition called the CIN. It has also caused a pre-cancer or cancer of the inner part of the cervix of the women. And cervix is obviously the neck of the uterus. And then obviously it can cause things like vulval cancers, cause things like vaginal cancers and anal cancers as well. And obviously the common one, which is not a cancer, but is extremely irritating and transmits easily, is the genital warts, which I'll talk about to you in a short while. All right, so very quickly, what is genital warts? It's a non-cancerous thing which grows usually in the genital areas of both men and women, and it is commonly caused by the virus number 6 and number 11. These are the two culprits, the HPV group of the 150 types, 6 and 11 causes genital warts. 90% of genital warts are caused by these two viruses, and it is highly infectious. More than 75% of the time it can transmit to other people, your partners. And the problem is that even if you cure it, sometimes it comes back and again, and it becomes troublesome. All right, so now we're talking about human papillomavirus, and we're talking about cancer as a result of it. So how common is this condition? Well, up to 12.7 million new cancers are diagnosed in the world every year, of which about 5% of that are attributable to the human papillomavirus. So in other words, cancers which are related to HPV causes about 9% of all new cancers, both in women and especially in the developing world, and more commonly in developed world, and more commonly in developing world, which is 14%. I'm going to digress a little bit and talk about this cost in cancer. Now, this study basically at the St. George Institute found that if any person gets affected by cancer in the family, either a relative or a spouse or a child or a parent, about 50% of the time there will be financial devastation. In other words, the cost of treating the cancer is so expensive that it affects both the family, the immediate family, and sometimes the extended family. And this is just on a financial point of view. There are also psychological costs, the cost of um, um, loss from time from work, fear for the health of the relative, a lot of stress and sleepless nights, and so forth. So, in other words, cancer is a major problem not only in all over the world, but in Southeast Asia, it's a financial devastation in 50% of people at least. So in other words, if you have a method which can prevent cancer, wouldn't it be wonderful? And there are not many cancers which are preventable in the world. Cervical cancer, cancer of the anus, and some of the nasopharyngeal cancer, all of which are as a result of the human papillomavirus, is one of the few preventable cancers, and this is why it's so important. So the question now is, what happens if you get an HPV infection? As I told you, more than 80% of the time you kill the virus, you get rid of it, you don't know you have had it, end of the story, finish. Now, for those around about those who cannot clear the virus, not 20% or so, within 1 year, it causes a precancerous disease of the cervix in women, of the uterine cervix. And then if assuming you can't clear it, infection continues, then sometime between 0 to 5 years, it becomes a higher stage of a pre-cancer called CIN2 or 3. CIN is cervical intraepithelial neoplasia, which is a precancerous condition. And then you have something like up to a 20-year time frame before it outright becomes a cervical cancer. So you have a lot of window to arrest the disease, to detect, to arrest this disease, and hence to kill it or to cure it. So in other words, there are methods to diagnose early and then to treat it early before it turns out right, it transmits to all over the whole body. So to put things in perspective, how often, how common is the cervical cancer? Well, in Malaysia at least, the commonest cause of cancer in women is breast cancer by far up to 37%. But the second commonest, around about half of it, is cervical cancer, and that is the scale of the problem. And is then followed by colorectal cancer and ovarian cancer and so forth. The other thing we need to talk about is that cervical cancer mainly affects women in the reproductive age group. So, in other words, here you are talking about women who are at the peak of their importance in the 40s to 60s and so forth. Mothers, career women, women who are taking care of their children, the teenagers, or some who are just starting to have young children. So, in other words, it affects some of the most productive people in their lifetimes. Okay, so we will talk about many types of HPV viruses. 6 and 11, cervical ward, non-cancerous, troublesome, okay. Now we're talking about what about the one which causes cervical cancer. The commonest one is type 16, and you must remember this. If you remember nothing else, remember type 16 is the biggest culprit, that which is the biggest variant causes the most disease in both men and women. Majority of the conditions are caused by serotype 16. So in this graph, we look at it. So you have serotype 16, which causes almost all these conditions, all right, of both the cervix, the vulva, the vagina, the penis. Number 16 is the best, it's the worst guy, followed by number 18, and then number 45, 31, and so on and so forth, which are far down. I'm telling you this because when we talk about a vaccine later on, the importance of knowing which serotype is key to determining what vaccine you should receive. So we've talked about women and cervical cancer, and a lot of men think that, it's a women's disease, okay, we've got wives and children and daughters and mothers who are at risk. But what about men? We are not affected generally, right? Wrong. It's not like this. Persistent HPV infection, and a lot of times you don't know you have it, can cause cancer of the penis, pre-cancer of the penis, anal cancer, and men and as well as women have anus, penile cancer, cancer of the head and neck, and even the larynx. Okay, and of course it causes genital warts as well. So in pre-cancer disease of the anus and cancer, once again, type 16 and 18 is common in 72% of it. Number one culprit, number two culprit. And obviously for women as well, these two are the major culprits. Also, it's important to have in men, homosexual men, men having sex with men, that they are at high risk of getting human papillomavirus in the anus as well, hence leading to risk of anal cancers. Now, this slide serves to illustrate the fact that anal cancer is increasing in both men and women. An example is in the United States, but happens all over the world as well. The anal cancer is getting commoner and commoner in all these various countries. Okay, so the index of awareness is fairly low. So now we talk about how many percent of all these cancers are affected by the HPV virus. In cervical cancer in women, almost all, 99.7, say 100% of them are due to HPV. You stop the HPV, you don't get this condition. In anal cancer, 88%, in vaginal cancer, 74%, and in vulval cancer, 30%. So it's a major disease both in men and in women, and hence the awareness must be higher, and more importantly, we have a method to prevent it from even occurring in the first place, and that is important. Okay, so now we talk about how much the disease burden is for both a developed as well as a developing country. So notice that in all age groups between age of 15 and then 45 and 54 until the older age group, always the poorer countries get it worst. The richer countries don't get it so badly. So poorer countries need the vaccine even more. So now we're talking about, say we talk about cervical cancer to begin with. So you have a way of diagnosing it. So how are you going to take care of it, reduce the disease burden, cure it early? Two ways. Number one, screening. Screening means you detect it early, take care of the disease, treat it, end of the story. And this is basically the pap-smear. The pap-smear has been around since the 1950s. And does pap-smear help reduce the incidence of cervical cancer? Answer is yes. In England, between this time frame of 71 to 95, the fact that cervical cancer pap smear is universally adopted hence has reduced the incidence of cervical cancer enormously, while the screening has increased. So that is by means of screening. But an enhanced screening is useful for both cervical cancer and cervical precancer. But what about all these other conditions where there's no screening, there's no pap smear for anus, there's no pap smear for vulval cancer and things like that? That is where your prevention comes in. Your prevention comes in the form of vaccination. Okay, so in order to know vaccination, you must know what virus causes that disease, and hence you can vaccinate against the virus. And the advance of the knowledge, the fact that we know that HPV is fully responsible for all these conditions, allows us to create a vaccine which prevents this disease. All over the world, all countries worldwide, you find that all these viruses are responsible for up to 90, around about 90% of all the cervical cancers in the world, all over. Okay, now this is an important study done by my good friend Professor Wu Yinling in the University of Malaya in the context of Malaysia. In the context of Malaysia, she did a swab looking for what kind of virus type is common in the Malaysian population. So indeed, type 16 is the commonest, but contrary to what we thought and represents the rest of the world, type 18 is not the second commonest. Type 52 is the second commonest. Type 18 is not even the third commonest or the fourth commonest. You notice that type 52 is followed by type 68 and 58 and so forth before type 18 comes on. So in other words, and this is important for the type of vaccine which we'll talk about in a short while. And similarly, for a pre-cancer at a higher stage, stage 2 and 3 pre-cancer and pre-cancer of the internal part of the cervix, it is also caused in Malaysia, number 1, by serotype 16, followed by 52, not 18, followed by 68 in the Malaysian context. All right. Now, what happens to those with invasive cancer? Invasive cancer in Malaysia, however, is most commonly caused by 16, followed by 18. So invasive cancer 16, 18, non-invasive precancerous 16, followed by 54, and the others first. And then what she did is she looked for what kind of virus is found in the mouth and the genital tract of Malaysian women. And she looked at it across all age groups. And you find that in the cervix, even young girls aged 18 to 24, you find that these are the ones which are present here, all of this. And in the mouth, the older the women get, the more of this HPV virus is found in the mouth of women. And she then did the study for men and found that in the penis and the anus, you find that round about there, the number of HPV infection across age groups about the same for penile carriage, and for anal sample is around there, but the older the man gets, the more of them have oral HPV infection. Okay, therefore, prevention is important, and we know that the various 9 serotypes, 9 viruses are responsible for all these infections. The first vaccines to prevent cervical cancer and the other cancers, the HPV, the first that comes out is actually the one by Gardasil by Merck, which is basically 6, 11, 16, 18, and the one by the other company, Glaxo, is by 16 and 18. So remember, we all thought that 16 is very important, you must have it. Then 18, second commoners. 6 and 11 is present to prevent genital warts. Okay, the question now is, suppose you immunize everybody in the whole population, will you actually bring down the incidence of cervical cancer? Now, cervical cancer, I told you, takes about maybe 10 to 20 years to develop from the point you get infection. So a faster way to see whether it works or not is to look at genital warts, because genital warts spreads faster, also caused by the two HPV viruses. And actually, you can inject, prevent the two viruses and see whether the incidence comes down. And in Australia, over this time frame of 2004 to 2011, the whole population has been vaccinated against the HPV 4 serotypes, and found that it is found that the genital wart incidence came down. In other words, yes, indeed it works. Pap-smear works. Immunization against the HPV works to reduce cervical cancer and the genital warts. Okay, so now we tell you that in the Asian context and in many other countries in Asia, in Malaysia, in Singapore, and Hong Kong, 16 is the commonest, 18 is not the second commonest, you have the other serotypes commonly. So the new vaccine, the 9 virus vaccine, is most useful for preventing the other types, especially in the context of the Southeast Asian region. Okay, so suppose you have had this O4 virus vaccine before. So the question now is, suppose you have the new one, which is 9 virus, will you add on to your prevention? Well, the answer is obviously yes, it is. For cervical cancer, it increases your protection by another 20%. So for anal cancer, it increases by around 10%. For vulval cancers, around 15%. And for vaginal cancers, about 20%. So in other words, if you have received the 4 virus vaccine, will you benefit from receiving the 9 virus vaccine? Obviously, it is. Answer is yes, it does. So this is very quickly what's the difference between the 4 virus and the 9 virus. Just basically, it's a bit technical, but there's some increases in dosage, and obviously the 5 further added viruses will protect you. Okay, side effects. You receive the vaccine, what are your side effects? Commonly, it's just the pain over the place of infection. You have pain, swelling, redness, each 1-2 days. It goes away after some time. Nothing, no big deal. Systemic effects means what happens to the rest of the body. You get headache, bit of fever, bit of nausea sometimes, tiredness, 1-2 days, at the most a week, it goes away. So I'm telling you this because sometimes you get this news from the anti-vaccine groups of people who are anti-diphtheria vaccine, anti all types of childhood vaccine, and anti-cervical cancer vaccine as well, the HPV vaccine. And they tell you that, oh, you get paralysis from it, you die from it, you get all of this. So is it true or not? Well, the answer is these are the common side effects. None of that we talk about all these major side effects is proven to result from the vaccine. In other words, false. It's not true. And therefore, many countries, advanced countries which have done, the regulatory bodies have gone through all the data. United States, Canada, European Union has recommended the 9-valent HPV vaccine. In other words, it is safe. There is no major effect. WHO has sanctioned it, and hence it should be recommended. No concerns about all these funny side effects that you hear about, listen to about, for people who try to bring in their own absurd views. Now we talk about giving vaccine to both men and women. All right, so gender neutral vaccine. For a long time, we think that this vaccine is only meant for women. Now, is that true or not? Answer is no. Men should also reduce the risk. And they reduce the risk for two advantages. Number one, remember, men can also get anal cancers. They can also get genital warts. They can also be at risk of oral and throat cancers. So therefore, if men receive this vaccine, they are lowered. The risk of getting this is much lower. But on top of that, the fact that you receive the vaccine means that your risk of transmitting to your female partner is also much lower, and hence this is an added benefit. Okay, so so basically it ensures that it prevents as the community the cervical cancer, genital warts, anal cancers, mouth, throat, and neck cancers. So HPV vaccine is very important. Okay, so this is a quote by Dr. N. Shushad, which says that preteens need the HPV vaccine today to prevent HPV cancers of tomorrow. In other words, you receive a cancer today, you will prevent cancers in the future. So that is the importance of receiving the HPV vaccine. All right. Now I'm open to questions from anybody, so feel free to ask. So I have a question here which says, does vaginal discharge mean that there's something wrong with me? So this question is obviously not addressing the human papillomavirus and the cervical cancer, but a general question for women's health. All right, so the answer to this is um, it depends on the age group, depends on what kind of discharge. Let's generally divide women's age group into the pre-pubertal, which are the young girls, the women of reproductive age group, which means say age of say 14 to about 49 or 50, and the postmenopausal women. For the reproductive age group, vaginal discharge is common and depends on the menstrual cycle of the women. So the first half of the cycle, they actually have sort of a whitish discharge, and this is the result of estrogen, the female hormone, which then causes the vagina to have secretions, and it is common and it is normal. In the ovulatory stage, at the point where they produce eggs, the vaginal discharge is very sticky and you can stretch it, and it's thick and white and you can stretch it. And this is the old way of how people say that this lady is ovulating now, she's having her egg hatching now, and that's an indication of fertility. The next third half of the cycle is where the eggs have hatched, and then what is called a secretory phase, where the vagina now, yes, has a more thick and yellowish discharge. All of these are normal, but if the discharge is itchy, if it's painful, it smarts, it leaks out very often, it stains a lot, then it is abnormal, and hence you need to see a medical professional for diagnosis and for treatment. And that is for women of reproductive age group. Pre-pubertal girls shouldn't have any discharge. If they have any discharge, often it's an infection, and usually they would alert us to, well, either some kids playing and they insert some foreign body in the vagina, or sometimes an indication of sexual abuse. In postmenopausal women, it's a different story altogether. Postmenopausal women have very dry vaginas because they are lacking in estrogen hormones, and then very prone to infection because the vagina is very thin. And the result of that is that they get infection very commonly. But another reason is because they're more at risk of getting cancers. And if do have cancers, then it sometimes can present with blood-stained discharge, false-smelling discharge, yellowish discharge as well. So for postmenopausal women, discharge needs medical attention. All right. Second question. I have terrible mood swings and feel really depressed for a week before my period. What can I do? This sounds like what is called a premenstrual tension. And this is a result of one kind of hormone called progesterone. Progesterone in the second half of the cycle causes it has this effect of causing sometimes mood swings, depression, easy anger, and irritable mood for women. In a way, it is normal, but for some women who is affected very badly, who feels they need to kill somebody before their periods, then there are methods to treat it. Basically, we will give hormones to prevent the swings of your hormones so that you don't get all these swings and you get all this bad premenstrual tension. I also have a question from Mr. Tony Belloni who asked, I got vaccinated somewhere in the year 2012, 3 doses. Should I go for it again today at the mid age 30? Well, as I've discussed earlier on, the answer is you should. You should because in the mid 2012, most likely you have a 4 virus vaccine, which means that you are protected, as I told you about, around about this is a man, around about 65, 70, 80% from any of the HPV infections. We now have added 5 serotypes in the vaccine, which increases your protection up to 90%. Yes, it would be beneficial for receiving the 9 virus vaccine, and I would do that. In fact, what I've done is I've actually asked my daughter who had been vaccinated a couple of years back with the 4 virus vaccine to receive the 9 virus vaccine. I've given my daughters the 9 virus vaccine. So yes, I would strongly recommend that. I have noticed some painful bumps down there. What are they and how should I know if it's something more serious? Women shouldn't have painful and lumps down growth in the perineum. If they do have any of these painful growth, especially if they're infected, they must see a medical professional, have it sorted out, get it treated. All right, it may be serious, it may not be serious, it needs to be looked at. Okay, I'm 58 years old. Should I be going for my annual pap-smear? Answer is yes, you should. If you have had sexual exposure, even at an early age, even if you have stopped sexual activities for the past number of years, you should get an annual pap-smear. But nowadays, pap-smears are not just looking at cells for abnormal cells for an early diagnosis. They are not pap-smears which looks for the HPV virus, what is called the HPV DNA virus. And the pap smear picks up this virus. If you don't have the virus and your pap smear is normal, have your smear up to once every 3 years, it is okay. Otherwise, if you choose to have closer screening, annual pap smear is fine as well, especially if you do not have the HPV screening concurrently. What is the recommended age to get an HPV vaccination? The vaccine can be given from age of 9 to age of 45 for both men and women, boys and girls. Between age of 9 to age of 14, you only need 2 doses. That means you can receive one now, one 6 months later. If you're above age of 15, you need all the 3 full doses of vaccine. And get at the moment gives you a lifetime immunity. There's no need for a booster dose. So that is the story. There's another question from Mr. Don Edwards. Oh, sorry, Miss Don Edwards, I think. Following on to Mr. Tony's question, should males get this vaccine? That is the thrust of one of the thrusts of this presentation. For a long time, men has been neglected. They think it's a women's vaccine. The only women should receive it. No, men should receive it, especially if you're aiming for a herd community. Everybody in the community wants to be reduce the incidence of HPV virus. Men and women should receive it. And I also have illustrated the benefits for the men, not only in reducing the risk of anal cancers and reduces oropharyngeal nasal cancers, but especially reducing the risk of transmitting it to the female partners as well. How do I know if my partner or I have been exposed to HPV? Obviously, you do a swab. You do a swab either from the cervix or during a pap smear for women. If you choose to, you can swab the men for the penis or the anus. But the point is, if you swab the penis or the anus or all in the man, it is of no importance. Why? Because here you have the virus over these areas. But the whole idea is you don't want the virus to go into the cells in the mucocutaneous junction and hence causes changes in the cells and gives rise to disease or abnormal growth. You just carry the virus in your body, in the vagina, in the anus, or it doesn't matter because most of the time your body kills it, gets rid of it anyway. And if it doesn't incorporate into a cell, it's only transient. It is of no consequence. So you can know it, but there's no need to know about it because it's of no consequence. You have it tomorrow, don't have it the next day, end of the story, not important to screen for it. Is HPV vaccine still effective after a person has been infected with HPV? So in other words, you have had the disease, say for example, you have a pre-cancer of the cervix or pre-cancer of the vagina or whatever it is. Should you still receive the vaccine? Answer is yes, you should. Okay, let's say you're infected by serotype number 16 or 18 or whatever, 45 or whatever. It's highly unlikely that you get infected with all 9 of the viruses. And hence, if you receive the 9 virus vaccine, you get protected by the rest of the 8 of them. You protect against the other 8 coming in to infect you. That's the first thing. The second thing is, if your condition, your pre-cancer, whatever has been treated, we know that if you receive the vaccine, it prevents or reduces the incidence of a recurrence of that condition again. So the answer is yes, it is not effective in preventing the first virus which you got it, is effective in preventing the disease which can be caused by all the HPV group as a whole. Can a person spread HPV to somebody else even after getting the HPV vaccine? Getting the vaccine means that you're now protected from the virus going into your cell and causing disease inside your cell. The virus can exist in your body, it cannot enter your cell. You now have a barrier, a force field. So the virus cannot get into your body. It can be lying, hanging around in your body. It doesn't cause disease. So therefore, you suppose it stays here in the vagina or the penis or whatever, you can spread to the next person who you have sexual exposure to when the other person doesn't have vaccination. In other words, you can spread it to the other person. And if the other person cannot clear the virus, then the virus theoretically can get into the cells and cause disease in the other person. So the answer is you should then vaccinate, if possible, the whole population. And the answer to this question is yes, it can. If I'm affected by HPV orally, can I pass the virus to my children if I kiss them? Chances are very, very low, but in theory, yes. Why? Suppose you hold it in your mouth, okay, and basically 16, 18, which are the bad ones, usually you have it in the genital areas, the anal areas. The ones in the mouth are usually not 16, 18, not the bad ones. But if you carry in the mouth, they won't cause any diseases. If you kiss it to if you kiss your kids, in theory, you can pass it to them. But almost always they are innocuous, doesn't cause any condition, no problem, and there is no effect from it. So feel safe to kiss your children, no problem with worrying about that. What are the signs and symptoms of HPV? Now that is the problem. The problem is that there are no signs and symptoms. You don't know you have it, and a lot of times you clear it without even knowing you had it. You don't know it. So in other words, there are no signs and symptoms. If you do get the 6 and 11, which then causes genital warts in you, then you have the genital warts, which I showed illustration pictures early on. You can get all these cauliflower-like growth, and they're very nuisance. They cause itch, they cause irritation, and it can spread very easily. But almost always, people who have HPV infection, there are no signs and symptoms. You don't know that you have it, and hence very dangerous. You spread to other people. So the idea is vaccinate, prevent the disease in men and in women. Obviously, in women, do screening tests for pap-smear annually. And if you want to, do the pap-smear looking for HPV DNA virus as well. All right, so the take-home message is here you have a virus vaccine which actually save life, prevent cancer, and therefore it is very important for everybody to know about it and consider getting yourself vaccinated. You, your loved ones, your children especially. All right. Thank you. Thank you for joining us.